There are 4 types of ultrasound in the CPT. The physician's notes must specifically state what type of ultrasound was performed. A mode is a one-dimensional display that shows the time it takes the sound wave to reach a structure and reflect back. A stands for the amplitude of sound, return, or echo. M mode is a one-dimensional display of the movement of structures. The M stands for motion. A B scan is a two-dimensional display of the structure and the motion of tissues and organs. B stands for brightness. The sound waves bounce off of structures and are projected onto a black and white screen. B-scan is also known as grayscale ultrasound because strong signals display as black and weak signals display as lighter shades of gray. A real-time scan is a two-dimensional image of the structures and the motion of tissues and organs. Radiation oncology is therapeutic instead of diagnostic in nature. These codes can be used in management of the patient from the initial consultation throughout the course of treatment. Radiation oncology is for the purpose of eradicating or shrinking the neoplasm or obstruction. Radiation oncology includes the actual clinical treatment, medical radiation, planning, and the delivery and management of the radiation services. Clinical treatment planning reflects professional services provided by the physician. Clinical treatment planning includes interpretation of tumor localization, treatment volume determination, dosage determination, number of ports, and the number of treatment devices that will be used. The code covers the physician thinking of how to best treat the patient for cancer. Simulation is the examination performed for the physician to view a closer look at the tumor, and from this simulation the physician is able to come up with the treatment plan. Simulation involves identification of treatment areas and appropriate placement of ports for radiation treatment. Planning and simulation codes are coded only once per set of procedures. Radiation treatment delivery encompasses the radiation therapy as well as the care of the patient throughout their treatment. Radiation treatment delivery are used to report the actual delivery of radiation. Clinical management is based on 5 fractions or treatment sessions, regardless of the time intervals that each separate delivery of treatment is. If the patient receives 5 fractions and then an additional 1 or 2 fractions, after that, the additional fractions are not coded. Nuclear medicine services deal with placement of radioactive material into the body and monitoring of emissions from the radioactive elements. Nuclear medicine studies are used for diagnostic studies and for therapeutic treatment. For example, radioactive material may be used during stress tests to monitor coronary artery blood flow. Nuclear medicine codes are divided primarily according to organ system. Radiopharmaceuticals are drugs used in testing the cause of a problem by indicating the location, size, or function of organs, tissues, or vessels. Patient condition is determined using the aid of radioactive material. If you have any questions regarding the radiology section of your CPT, please email me.